Dear students, today we are here with our topic that is insulin. In this session, we will study about diabetes, its types, and insulin, and few of the actions related to the insulin. So, let us start. Diabetes. Diabetes is a condition in which the patient suffers hyperglycemia. Hyperglycemia, which means that there is an increase in the blood glucose level. And there is altered metabolism of carbohydrates, lipids, and proteins. Diabetes have been categorized in two categories. Number first, type 1 and type 2. Type 1 is known as insulin dependent diabetes mellitus, represented as IDDM. Type 2 is known as non-insulin dependent diabetes mellitus. Non-insulin dependent diabetes mellitus, represented as NIDDM. In type 1, there is an autoimmune disorder. Type 1 is due to the autoimmune disorder in which the body produces antibodies against beta cells of pancreas. In type 1, type 1 is an autoimmune disorder in which the body produces antibodies against beta cells of pancreas. This type 1 is also known as juvenile onset diabetes mellitus. Juvenile onset diabetes mellitus. However, in type 2, there is an impaired insulin secretion. In type 2, there is impaired insulin secretion and is due to the decreased sensitivity of tissues to insulin. This type 2 occurs in adults. Hyperglycemia causes different pathological states in body, that is retinopathy, nephropathy, atherosclerosis, and gangrene of limbs. So the prolonged hyperglycemic condition in a body causes retinopathy, nephropathy, atherosclerosis, gangrene of limbs. Atherosclerosis is the build-up of cholesterol and fats in and on the artery walls. Gangrene is the death of the body tissues due to the lack of blood flow. Now these were the conditions related with the insulin secretion, either due to the impaired insulin secretion or due to the absence of insulin. Now coming to the insulin. Insulin is secreted by beta cells of islets of Langerhans in pancreas. Langerhans in pancreas. Insulin is a polypeptide molecule. Which contains 51 amino acids. It contains two chains, chain A and chain B. Chain A contains 21 amino acids, while chain B contains 30 amino acids. 30 amino acids. This insulin is stored in granules of beta cells and is released to the increased blood glucose level. So insulin gets released when there is an increase in the blood glucose level. It means that insulin is secreted in response to the increase in the blood glucose level. Normal pancreas release about 20 to 40 units of insulin per day. So normally our body secretes 20 to 40 units of insulin. It is metabolized in liver, kidney and skeletal muscles by means of an enzyme that is known as insulinase. Insulinase degrades its chains, which gets converted into the simpler components. Now, before starting the actions of insulin, let us study about few of the terms related to its action. Our body uses glucose as a main source of energy. Glucose is the main source of energy which is utilized by our body. This glucose is used to carry our daily life activities, and the excessive glucose is stored in the form of glycogen in liver. So excessive glucose which is present in our body gets converted to glycogen in liver as a stored form, and this process is known as glycogenesis. So glycogenesis is a conversion of glucose to glycogen. This is a reversible process. So when glycogen converts back to the glucose, we call that process as glycogenolysis. So these are the two opposite processes. When glucose gets converted into glycogen, we call that as glycogenesis, while as when glycogen gets converted back to the glucose, we call that as glycogenolysis. Another term is gluconeogenesis. Gluconeogenesis is the synthesis of glucose from non-carbohydrate sources like fats, amino acids, and pyruvate. So gluconeogenesis is the synthesis of glucose from non-carbohydrate sources like fats, amino acids, and pyruvate. These are the processes which we will use in our further lectures. So this was about the insulin. For further details, we will meet in next session. Thank you.